Welcome back to OrthoNY York Pain Management University, freshman year. Today, one of our topics will be to discuss some of the newer options in pain control. Platelet-rich plasma and stem cell therapy are techniques of what we call autologous healing. Again, this is another fancy doctor word, but hopefully after watching this video, you'll have a clear understanding of the meaning. Let's go through it in more detail. Through the course of our lives, we've all had at least a minor cut or scratch. Fortunately, they tend to heal on their own. Have you ever wondered how? Once a cut in skin, muscle, or connective tissue is identified, your body's blood cells surround the area. Platelets, small cells within the body, help to directly form a clot over the injury site. These little cells also release a whole bunch of chemicals locally to help with additional healing. Think of it as an SOS signal. The platelets wave a flag over the area to help recruit additional healing cells. Some of these cells are referred to as stem cells. These are immature cells that have the ability to help rebuild and repair damaged tissue. Let's bring this to a real-life example. Imagine you want to do a remodel on your bathroom. Unless you're one of those geniuses on HGTV, you'll likely need some help. The first thing you may do is call up a general contractor. A contractor will assess the area and discuss the work needed to be done. Once a contract is signed, they'll likely bring over a team of construction workers to help with the remodel. After weeks or months, hopefully you have the bathroom you've desired. In this analogy, platelets are like contractors. The stem cells are like the construction workers. Together, they help to repair the damaged and injured tissue. The body's ability to self-heal has been well known for centuries. In fact, a long time ago, the famous French writer and philosopher Voltaire once said, "The art of medicine consists of amusing the patient while nature cures the disease." Okay, well, this is all part of the normal healing process. How can we help? Over the years, we've learned that damaged and injured tissues sometimes need help to heal. Help generally comes in the form of recruiting additional blood to the injured site. This is precisely why we suggest hot packs, massage, physical therapy, and home exercise. All stimulate blood flow to help with healing. For certain deep muscular, tendinous, and joint conditions, we've also found that we can use blood products to help with healing. The details of the exact medical conditions treated should be discussed with your pain physician. Here's how it works. We extract blood from your veins, much like you would when donating blood. We then spin the blood around in a large centrifuge device for about 10 to 20 minutes. This helps us extract those healthy platelet cells. The platelets mixed with plasma is referred to as PRP, or platelet-rich plasma. Now, these can be injected into the injured muscle, tendon, or joint. Stem cells can be simultaneously extracted from your fat or bone marrow to assist with the healing processes. These cells can also be injected into the injured site. As we said earlier, this concept of self-healing is referred to as autologous healing. Now we know what that big word means. Remember, in this process, we are looking to create an inflammatory process. Even the best contractors and builders first make a little mess before we see the finished product. Mild swelling and discomfort at the injured site is a good thing and suggests that healing is going on. For that reason, patients are informed to refrain from using ice to the treated area and told not to use anti-inflammatory medications for a week before and up to 2 weeks after treatment. Patients are also told to restrict high-impact exercises after treatment to avoid further injury to healing tissue. Talk to your doctors about details on activity modification after treatment. We strongly believe that this non-pharmacologic therapy is an effective way to promote healing in our patients. We hope this has been helpful. Please like this video and subscribe to our channel for more educational videos. And remember, no video replaces a formal medical consult. Talk soon.